Okay, we are live on Facebook. I'll share with you the link which you can share with your audiences. Just a second. I have shared the link with you on your WhatsApp. Now you can share the link on your Instagram profile, and anyone who is interested, they can quickly join in the live. Meanwhile, we start with the live. Between when you would be explaining, I will be completing this process for Autism Connect's page as well. Great. So firstly, I just see if people have started joining us, then I can just start with the introduction.
Okay.
Great. We do have viewers started joining us. Great. So hello, everyone. Welcome to today's Facebook Live session. I'm your host, Krisha, and today we have a very special guest with us, Dr. Raghida Achkar. She's an expert in the field of autism and sensory processing. We'll be diving into the fascinating topic of how the Tomatis approach can play a role in addressing sensory challenges for individuals with autism. So before starting the live, I would like to give a small speaker introduction. So Dr. Raghida is a neuropediatric occupational therapist with more than 20 years of experience in handling successfully pediatric, orthopedic, and other neurological conditions, as well as autistic children and children with learning difficulties across the Middle East region. She's the head of occupational therapy Arabic services at the Developing Child Center, Dubai. So that was a great introduction, and now we can possibly start with the live. So before we get started, could you please provide a brief overview of autism and sensory processing challenges for our viewers who might not be familiar with it?
Yes, thank you for the introduction. We'll be talking today about the sensory processing disorder and versus the Tomatis method and how it works together. Let me start by introducing the Tomatis approach and how can this Tomatis can have a direct effect on the sensory processing disorder, especially with kids with autism, and especially with the kids having the auditory processing disorder. The Tomatis method is a natural approach to neurosensory stimulation. It's a listening program with the music and voice in real time in order to capture the brain's attention and to develop motor, emotional, and cognitive skills. It's developed by the French doctor and researcher Alfred Tomatis. It relies on advanced technology and the excellence of its trained profession on how to use it and how to apply it with the kids with sensory processing disorder.
Okay, that was insightful. Now let's dive into the Tomatis approach. Could you explain what the Tomatis approach is and how it relates to addressing sensory issues in individuals with autism?
Okay, like we said, the Tomatis method, it's a kind of listening program to learn and transformations through Tomatis high frequencies. It can, we have 4 criteria. We have the gated music. It's kind of special music, started with the normal and regular music and gated with frequencies with like hertz and like decibel. We have the bone conduction because the kids can really apply the headphones. We have the bone conduction with the kind of vibrator located in the ear and in the brain. And with we have the right ear dominance and the left ear dominance, which indicated with the kid, and it can stimulate what we can say the electronic ear with the kid.
Okay, so Can you share any research findings or example of how the Tomatis approach has been beneficial for individuals on the autism spectrum?
Yes, we did the research and we apply it on like 100 autistic kids,
Okay.
and we tested on many area. Okay, with the percentage of reliability. So the well-being, it's increased 20%. The reading, writing, and spelling, 39%. The creativity, 49%. The relaxation, especially, 54%. By the way, I can share all my research and my PowerPoint as long as with the Autism Connect and on the page, whatever, with all the research, all the data, and with all the information. Musical and vocal skills, 63%. Movement, sport, and rhythm, 66%. Intrapersonal growth to know and express self, 69% as well. Behavior, 79%. It's directly linked to the good behavior. Attention, 80%. Academic achievement, thinking, learning, 81%. Listening and speech, 85%. Interpersonal growth, 87%. This is really was a great study for the areas of change using the Tomatis and applied from the first side, because like we said, Tomatis, it's non one shot. It's like a program applied for 14 days intensive every day, 1 hour, okay, using the headphones and doing like occupational therapy, sensory processing, play therapy. So for 14 days for the first program, we can do like the brain mapping to see what's changed, and we can test this one, and we can apply after 1 month another program, like sensory program 0, sensory program 1, and it's a little bit of by evolution.
Okay, so these were great numbers, and we would definitely love to have this kind of information on Autism Connect's page as well as the website, because it would be really beneficial for all the people who do not have an idea about this kind of approach. So we would definitely love to have this information as a blog on our website, so we can further like go ahead with how we can publish a blog on this topic. So that's really insightful, and I hope the audiences would be very much interested to know more about this approach. So now let's dive into our next question. What are the areas of change for kids with autism?
Okay, we have many areas of change, like academic, cognitive, sensory, and communication. We talk about Tomatis, we talk about the listening integrator. What Tomatis can integrate with the kids. One, it's a perception. When we talk about perception, we talk about auditive perception and visual perception. Okay, when we talk about one, it's perception. Two, it's action. How can we really like modulate between the hypersensitivity and the hyposensitivity? So we have this action and this modulation. Plus, we have this cognition. Okay, it can increase the reading, the writing, and the cognition skills. Fourth, it can really integrate, activate through mirror neurons. We all know that, especially with kids with autistic, what we can target is the mirror neurons, and this mirror neurons, it's copying through feedback. It's like a neurofeedback. So we give him like insights, input from outside. They can really integrate it through the brain, and like they can mirroring, and like can give it feedback to the body, to the behavior, to the sensory, and all overall. So it can give direct active during execution of a goal, direct action, and while perceiving the same action being performed by another person. So it can really have a direct action on the neuron, on the mirror neurons. And we on this area we can call Tomatis like audio psychophonology. Okay, referring to three functions: sensory, cognitive, and motor. in the same time. So that's why when we're applying the Tomatis method to the kid, he's playing, his using his hand, we're giving him like a sensory stuff, we're giving him like a visual stuff. So we can addressing and referring to three functions, like we said, sensory, cognitive, and motor skills at the same time.
That was great information and very fascinating. So, what are the listening integrators?
Okay, the listening integrators, it's like the same, like we can say the auditory system. Okay, everybody talk about the auditory processing disorder. The auditory processing as a human, okay, we have like we can select. So I'm talking to you. So I'm selective only what you're saying to me, and I can respond to you. When we have a trouble with the auditory system integration, all the input from the outside, it comes to the brain without any selectiveness. So we don't have the funnel to select what we have to really select, what we have to proceed, and what we have to act. So the listening, integrating, and the auditory system go through together, and it's like a kind of receptors, in the inner ear, who send the message to the brain, like we afferents. Okay, so we have this input, we have this auditory system, and it's like the receptor. Okay, it sends the message to the brain, like the afferents. The brain, under the influence of emotion, send messages to auditory receptor, ordering them to function efficiently. This is the afferents. So we have the input, we have the modulation, the processing into the brain, then we have the function and the efforts. Okay, this is the listening, integrating, and the auditory system, which is this like a circle one. It's stimulating by the tomatis with the inner ear, modulating, activating the brain, okay, giving the brain like ordering the brain to how to modulate, how to focus, and giving him on the other side the afferents to response or to modulate.
Okay, that's great. So in case if you have a PowerPoint presentation where in case you want to show our audiences some, hello, yeah. So
Yes.
in case if you have a presentation, you can definitely share your screen and like show it to our audiences what exactly like the numbers and everything you're talking about. So the next, like, would you like to share your screen? I have just given the permissions, like if you would love to.
Now it's difficult. I think I have my presentation on the computer. It's hard to share it on mine. It's hard a little bit. It's hard to do it.
That's totally fine. We can go
Okay.
without.
But as I said, I can share it all, and we have to put it like a data and like a reference as when you want.
That's great. That's great. So coming on to the next question, how does it work on the auditory processing system?
Okay. It's really linked to the brain. Like we have the cortex, the brain, we have the hippocampus, we have the cochlea, all the anatomy of the ears, the thalamus, the amygdala, and when the input, when it can really target, because we have this two kind of connection, the bone connection and the gate connection. When we have this both through the headphone and through the vibrator link from up and down, it can really work on like this circle, like we said, for example, if I have the screen, I have it here, I can maybe share it like this, for example. Okay. I don't know if, okay. So it comes from the cortex or the brain, go to the inner ears, working to the cochlea, the thalamus, the amygdala, and this can do the activation through the sympathetic system. It's really neurologic. It's really neurologic stuff. Sorry. Okay. And from this side, 1 minute. Okay. Okay, and from this side, we have two conduction pathways. Like we have the bone conduction and the air conductions. It can take two half of the brain, and they can do this kind of combination between the right brain and the left brain through the bone conduction and the air conduction.
Okay. Okay. So how can Tomatis be a holistic approach with autistic children? Like how and what is its impact?
Okay, it's multiple and holistic action with Tomatis because it can integrate sensory motor, the emotional. We'll all say that we have this music memory. We have this neuron mirror memory. Okay, sometimes when we can listen to kind of music, either we are so affective, so emotional, we can go back to some emotional. It can take us 10 years back. It can take us to one situation. So we have this part of the sensory motor because its sensory is auditory processing. We have the other, it's emotional. It's directly linked to the thalamus, as a part of the brain. It's linked to all the emotion, to all the memory and emotion. We have the linguistic because we all know that the auditory is directly linked to the verbal and to the linguistic. And we have the vestibular, because vestibular and cochlea, when we, with the kids, when we have this vestibular and the proprioception, how to move the primitive reflexes, it's directly linked to the ear, to the cochlea. So when we give this input to the vestibular and the cochlea are both strongly connected to the prefrontal cortex and to the cerebellum, okay, which is directly linked to the balance, to the coordination. And we have the executive function and the cognitive, because it's really linked to the frontal, like I said, and to the cortex. And the program to the Tomatis is called sensory program and executive program. SR and ER will have an effect on integration of all the processes. So like we said, sensory and motor, emotional, linguistic, cognitive, vestibular, and cochlea. This is the auditory processing mainly. That's why this multiple and holistic action, it's directly related to the Tomatis approach.
That was an insightful answer, and I hope all the audiences would understand everything in a proper order. So that was amazing. So I think our audiences are finding immense value in your responses. So now let's move on to our final question. So are there any case studies and evidence-based approach to this Tomatis approach?
Yes, we did. Like I said, Tomatis, it's evidence-proved approach, and it's a supplement to. It's important to many of the therapies that done with the kids, and the importance of the Tomatis. It's intensive and it's consistent. The direct impact is the brain stimulation and cortical arousal. It can improve really the cortical arousal and the response and fastener of the response, fine and gross motor skills, attention and working memory, emotion and stress regulation, socialization, language, speech, reading, writing, musical abilities, singing, but also playing an instrument. So this is the direct impact. The study is directed with the Tomatis sound therapy. The effect of the Tomatis sound reduction of autistic symptoms in children with autism. When we talk about kids with ASD, we talk about symptoms. Our goal is to minimize, to reduce the symptoms of these kids. On 34 autistic children aged from 4 to 8 years were selected from a rehabilitation center in USA, and then assigned randomly to 2 equal-sized experimental and control groups. The experimental group received sound therapy for 30 sessions of 120 minutes. The other group was administered as a pre and post test before and after the treatment. Okay? The conclusion was that the group that received the sound therapy or the listening program indicate can reduce the autistic symptoms, increase social interaction, communication, and reduce stereotypical movements. This is the most important and can be used as an effective treatment for autistic kids. So all the, like we said, the area was increased. All the symptoms, non-functional was increased compared to the kids, to 35 for autistic kids, compared to kids that didn't do the sound therapy with the Tomatis. So it's reduced mainly all the autistic symptoms.
Okay, so that really is a good change in the children with autism. So that was amazing. So thank you for that informative explanation. So now let's open the floor to our viewers if they have any questions. So we will just wait for like a minute or two in case if there are any questions, or else we will just conclude. So meanwhile, is there anything else you would like to share with our audiences?
No, mainly no, if there is any question. For Tomatis, so there is like a practitioner all over the world. So it's an international presence everywhere in the countries, and we have many practitioner level 1, level 2. So even when we can apply the Tomatis, we can really do the brain mapping later on to see what's increased, what's decreased, what still work. It's a evolutive treatment. And so we can track really the pre and post, and we can apply it on the goal of the kids. The transformation through Tomatis, it's mainly with the autistic kids, but with kids who have learning disabilities, ADD, ADHD, and especially with all the kids having the auditory processing disorder. Okay, like I said, okay, so they can join, they can go to the Tomatis platform all over the world, and we can find practitioner everywhere where they are located. And it's a little bit easy. For example, like they can do it a home program if the practitioner or the doctor can provide the program and the brain mapping at home, so the kid can do it on his comfort zone at home. They can provide the device at home and they can program it. Otherwise, many kids require to be in the therapy while doing another parallel activity. So it's a flexible approach. It's have effect, and it can work either at home or either during the therapy.
Okay, that's great. So I would just like to ask one question, like in case if somebody wants to get their child analyzed by this approach, so which professional or which therapist they should go and consult?
Okay, they have to look about it can be occupational therapist, it can be a doctor, it can be the most important has to be a Tomatis practitioner. Okay. Licensed Tomatis practitioner. So like I said, Tomatis has a platform, so they can check about Tomatis. Look, for example, I can share, for example, here, it's all over the world. When they really can go to the Tomatis Academy, Tomatis platform, they can list it, they can be aware about which country, where is it, and they can find all the practitioner license and located on which area closest and nearest. They can contact the practitioner. They can schedule, like I said, the first schedule, it will be like auto evaluation with a parent and with the practitioner, Tomatis practitioner. And later on, they can set the program, which program and how many days and how many hour per day it can be. For example, in UAE, we have many practitioners, and it can be related to the practitioner linked to the Tomatis Academy.
Okay, that's good. So I don't think so we have any further questions for this live. So I just like to conclude. So thank you once again for being a part of this amazing Facebook Live and for sharing your valuable expertise with us. And thank you to all the viewers for joining us today. If you found this discussion helpful, don't forget to share this video with others who might be benefited, and don't forget to follow Dr. Raghida on Instagram. We would be definitely sharing a link of this live on the Instagram. So anyone who has missed out this amazing live session, they can definitely go and watch the recorded version of it. And thank you so much, ma'am, once again coming on board and like bearing with us, bearing with the connectivity issues. That was like really frustrating on both the hands. But at the end, we did this live and it was an amazing session. And I hope all the audiences loved it. So thank you so much once again. And it was nice having you here. Hopefully we can collaborate further again in the future, and we can come up with some more amazing topics which audiences would really love to hear about.
Of course. I want to add something. Now I'm at the Developing Child Center, so we have a big team of expertise, multiple headers, so they can check as well our website. We have many practitioners, many expertise, many doctors, so we can answer to the question, answer to assessment by WhatsApp, by live, by Instagram, or by consultation. And thank you for having me, and sorry for all the introduction.
It was a pleasure. It was a pleasure having you here, and it was a pleasure talking to you. I would be just waiting for all the information part you were talking about, so we can add it to our blog section where people can go and just go through the blog and they can have an entire idea about what exactly Tomatis Approach is. So it was great. Thank you so much for joining us today.
Thank you. Thank you for you. Thank you. Okay, looking forward for next and next.
Yeah, sure.
Okay.
Bye-bye. Have a nice day.
Bye-bye. Bye-bye. Thank you.